Dear colleagues, I wish you a good appetite. Hope you enjoy the meal. It's a kind of anti-aging meal, as I see. Let me just give you a short overview and present you the Clancy Medical Faculty, which is a part of Thanyapura in Phuket. And the aim of Clancy Medical Faculty is to help you to become a very professional anti-aging physician. That means we provide you with education for everybody of you, if you have a clinic or if you're in a hospital, or even we work with hospitals internationally. Our main goal is prediction and prevention. That means that we are very focused on personalized medicine. No one shoe fits for everybody, as you know, and personalized medicine bases on genetic testing, on special high cutting-edge scientific laboratory testing, and cutting-edge scientific preventive therapies and treatments. Our belief is that prevention changes the world. Curing patient has not become as successful as it should be, especially when we go to chronic diseases. The reason for this lies in the nature of a high-tech medicine, claiming to cure and thereby very often creating sometimes dangerous and even life-threatening adverse effects and new diseases. We offer services for physicians worldwide and education. We give you business support. We offer you to specialize yourself to a preventative and regenerative doctor. We supply you with the special knowledge and with the tools to do this, from supplementation, laboratory testing, to stem cell treatments. Cancer Medical Faculty, or KMF, stands for Physician Support. We want you to belong to be a leading physician and to belong to a group of physicians practicing cutting-edge science and evidence-based medicine. We're helping you when you start. We know very well how hard it is to start a medical practice and generate money to cover the daily expenses. And 18 years of experience in the field of preventive, regenerative, and anti-aging medicine made us possible to write protocols, so we prevent you. We offer you more than 80 medical protocols or professional medical instruction. It started everything with me here in Munich, once a time, and the Clancy Institute on the right side you see here, and it was more developed in some other countries like Turkey, Spain. You see down this is the Technom Clinic in Barcelona, and then is Bomograd Vitalife company. And now we are in the best place you can imagine for preventive and regenerative medicine is Thanyapura, the sports and mind center and school for all people. Thanyapura hosts a lot of Olympic teams, homes a lot of perfect personal trainers, has a mind center that means offers meditation, offers teaching in how to change your lifestyle. So we call it active, healthy lifestyle, and that's where we learn, and that we have most of our lectures and most of our training season. We're picking you up where you are, nevertheless, when you started or you're already far advanced, we help you and pick you up where you are with our professors, a big board of professors, and our concept is from preventive to secondary prevention, primary prevention to secondary prevention, and to repair or regeneration. The primary prevention is actually what is more on the public health, but the secondary prevention, we focus very much when someone already had a disease and wants to avoid the coming disease. So it's more than anti-aging, it starts with young kids. As you know, epigenetic changes start in the womb of the mother. So we already look for young kids. We work in autism. We have genetic profiles for autism, for everything. And we work with a group of doctors and hospitals around the area where we can just give you the advice to do the same when you have your clinic. Cutting-edge laboratory diagnostic, including dried spot tests. We work with companies. You see one here as well, ZRT, and we doing a lot of tests in dried spots. We are working with genetic testing, as I told you already, and our treatment not only provides you with capsules and supplements and hormones, it provides you with a stem cell technique, a completely new stem cell technique. Our instruction sets are controlled by a professional team from the European Center of Aging Research and Education. You will get a fellowship of the eCare, and we are working just to give you with the same thing, a Master of Science with a European university. Our training and education team is composed of university-based professors. They mentor you. You make, in the second year, you have to do a thesis, and you search your own mentor, and you choose your own mentor to be there. We have nutritional experts from every country. From Malaysia, we have marketing experts. Actually, this is a certificate of fellowship, for example, where you see this will be given after 2 years, after 1 year, the diploma. The whole training is 2 years, 8 modules, and 80 different professional medical instruction, from cardiovascular disease to basic anti-aging, coming up to hormonal. Every hormone will be very thoroughly taught. The cutting edge of science is genetic testing, predictive testing, and for sure the stem cells. The future already begun. It's a breakthrough of the year, and we will probably give you a new thing. Regeneration learned from nature is a bioreset system, what we have just introduced into our system in Tanjapura Integrative Health Center, and as well into Clemson Medical Faculty for our doctors. It's a revolutionary thing, and you will see Dr. Bader will talk soon about this. Our additional scientific team, which you see here, are high-graded professors and presidents of international societies, like Professor Zubul is the president of the International Acne Society, Dr. Marita, the president of the IPRES, Plastic Surgery and Reconstructive Surgery Society. And last but not least, I may introduce to you Professor Augustinus Bader. Professor Bader is a very famous stem cell professor from the University of Leipzig. And let me just read his parts of his very impressive CV. He studied medicine in Italy, in Germany, in China, and the Shanghai Second Medical College for burns, Switzerland, and in Boston, USA. He has a specialization in habilitation in experimental surgery. He's also a board-certified pharmacologist and toxologist. Augustina Bader was given more than 450 lectures in national and international conferences. He contributed to more than 160 peer-reviewed papers and book contributions. His clinical most relevant intentions include a biological process that imitates bionic principles for stem cell activation and tissue regeneration. Most of his patients have global coverage. The currently active patent families are 27 with 200 international filings. He serves on the educational board and editorial board of Rejuvenation Research, Tissue Engineering and Regenerative Medicine, Artificial organs as well as cells, tissues and organs. He has been a member of the EU Annex II drafting group supporting the European Medical Agency. Augustinus Bader has been the scientific coordinator of one of the officially rated most successful EU projects over a period of 10 years in the material fields, and has been coordinator of several national multidisciplinary projects, organizer of major international, including 3 world congresses in the field of regenerative medicine and tissue engineering. Professor Augustinus, may I invite you to come up to the stage. Please give him a warm applause.
Dear Professor Glenzer, thank you very much for the kind introduction. It is my big honor to be invited to be here to speak to you in this beautiful Congress. And it was actually in 2009 that we organized our World Congress in this facility, and so it's a second time for me in this facility. Now let me introduce you to the concept of biobiological biobionic science and the application what Professor Glenser termed bioreset systems. I'm focusing on the scientific part of it. But I would like to introduce you to a point of care technology using the patient's own cells to induce regeneration. Now, what are the current limitations in conventional stem cell technologies or in vitro-based system? Of course, there's a large demand of time. If you have an acute injury in a patient, for example, a severe burn, the cells may just arrive too late, or if you have a heart attack patient, the need to treat this patient is an acute situation, and the logistics in conventional forms of stem cell or cell preparation is relatively complex, and also the cost of production is relatively high, and you as a medical doctor would have to purchase the system at a relatively high cost, because people believe that you can manufacture cells like a television set and just then sell it. If you go to specific cell sources, one of them is in historic times actually was developed to use xenogenic cells. However, we published about 10 years ago already that animal-derived viruses infect the human genome and become active thereafter, which was a concern of the FDA in the United States, and actually it stopped xenotransplantation. It still is persisting in stem cell application. I'm not judging about the efficiency, but this is just raising the concern about some safety issues. And also human cells derived from other human beings, so-called allogenic cells, carry human pathogenic viruses. There are about 4,000 known human viruses, and it is almost impossible to test all of them. You know, if you would receive a blood transfusion, it would be tested for HIV, hepatitis, or maybe agent like syphilis, but nobody tests for Coxsackie viruses that create cancer in women. And embryonal cells have been shown to carry a risk of oncogene activation in 80% of cases. In animal studies, tumor formation has occurred. And cell culture in general is difficult from a sterility point of view by introducing infection due to manipulation. And the sterility test may take just 2 days, so when the cells would arrive for transplantation, the doctor doing it has some risk in transplanting cells, and he or she would not know if they're really sterile or not. Now let me therefore show you a method that potentially addresses and solves these problems, but from a scientific point of view, it addresses another question, which is the question of reducing inflammation and preventing stem cells to become scar-forming cells. It is a cell technology that can be done totally at the point of care, and it relates to the use in acutely injured and trauma patients or chronically degenerated scar tissue. So what I will be showing you is a methodology that comes from real clinical practice and does have some application for rejuvenation, because it seems to strengthen and support the body regenerative capacity. Now let me start with the scientific concept first. Saying stem cells are like pilots. So what we really need to do is we need to give information to the pilot that carries the plane or would trigger the cells to go into a specific direction, but not only to arrive there, to create tissues, to create skin, bone, or liver in cases of injury. People in the past believed that it would be sufficient just to multiply stem cells, provide them, but in reality, stem cells are multipotent cells. They need information. They need to be told what to do. Now, let me first start by explaining to you the concept of endogenous stem cell activation. And this presentation is divided in several parts. The first one is the idea of endogenous stem cell activation, meaning activating the cells inside the patient. And the last or second part goes into different forms of clinical application, adding a cell therapy. And I will show you how the cells are prepared from the sources of stem cells that we have. And these include bone marrow, blood, and adipose tissue. But the fourth area is the site-specific tissue cells that are in all human tissues. Now, in cooperation with Professor Mahens, more than 10 years ago, we started to do animal studies, and molecules were identified. And you can see in these animal studies, on this side, in a deep secondary burn, in a rodent model, if a gel was applied topically on the skin of the burned animal, the wound heals by activating local stem cells in 7 days. In the control study, the control group, the wound, you can see the injury, but the wound has not epithelialized. So what I found out in a way, if I would cut myself here on the hand by mistake, a signaling process starts that induces trauma signaling like cytokine interleukin-6, one of TNF response locally, and this indicates to our human body the site of injury. I would never get twice as much skin on the other side. So this is present in the injury, but what is missing in a big burn, if I get a big burn on my arm, still we would get no perfect healing, we would form a scar. And why this may be the case? I believe it's because the signaling doesn't work anymore if the cells are damaged or dying and they cannot produce the signals. So what we do, we just replace signals in the first stage of endogenous stem cell activation. You can see a so-called donor site, a donor graft situation that is an identical size on the left arm. On the right arm in this patient, you can see the picture was taken at 6 days with identical treatment in a control group on this side. Such a wound would normally heal in 14 to 18 days. And it was treated identically with only one difference. On the other side, this stem cell activating peptide structure was given. You can see the wound has closed in 6 days. So there's a dramatic acceleration of wound healing, but qualitatively, you can see that the skin has not formed a scar formation. Now, this was our first young child. We have treated about 200 burn patients in Germany. Now you can see a deep second-degree burn, a deeper burn in a 2.5-year-old girl that was injured from boiling water, standing in boiling water for 20 to 30 seconds. And the normal standard therapy in Germany would be to do neglectomy on this patient, so the skin would be taken off by tangential excision and skin would be transplanted. You can see it was diagnosed as a deeper burn because it was not bleeding anymore in this whitish area on the 3rd day in the operating room. So what we did was applying this topical stem cell activating signaling peptides onto the wound. On the 3rd day in the operating room, you can see at 4 days the wound had closed and there's a part that was not healed. There was a new skin coming up here. You can see it's a little bit brighter. This is the pigmentation area. This was 3 weeks, half a year, 1 year later. You can see that this child has healed the burn wound without skin transplantation in an almost normally pigmented way, which is unusual for burns. Now, other applications would exist in aesthetic medicine. We learned a lot about laser treatment. I think this method could be combined very well with laser treatment. I'll show you a similar application now for what is called medical needling. Other applications for the method could be to apply them to prevent scar formation after cesarean section in women. We have done a multi-center clinical study now, which is an evidence-based study. And I will show you now some applications to chronic wounds. So wounds are even more complex to treat in diabetes because the patient has an underlying wound healing problem. A burn patient normally may be a healthy patient and doesn't have a healing problem. See, this was a non-responding patient that was treated according to the German guidelines of diabetology in one of the most renowned German hospitals at the University of Munich, and it did not heal for 3 years. We applied this treatment topically, and you can see at 1 week the granulation starts, and at 2 weeks the surgeon placed a skin transplant on it, which in a way stops the process. However, previous skin transplant had always failed in this patient. And we presented it to the national FDA, Food and Drug Administration of Germany, called the Bundesinstitut für Arzneimittel. And I concluded already in our scientific advice meetings, starting in 2009, there must be compelling evidence. Now, what is the evidence about it? I believe if my hand is a stem cell, it has 2 receptors, one for the local cytokines, another one for this co-signal, and we presented this mechanism. And it has so far worked in all clinical cases. Now, this is a venous erosion patient that would normally take 3 to 4 months to heal. It was treated a single time and healed in 1 week just by topical stem cell activation. It's an aesthetic application. You see, this was a burn patient, burned 3 years ago, and this lady had a scar formation on the neck. And here in this area, she received medical needling. Normally, you have a very strong inflammatory response and swelling of the face that would last maybe 7 to 10 days. You can see that the swelling that this patient went away after 24 hours and the cosmetic result after 6 days, which shows that an acceleration of healing and reduction in the scar. Now let me explain how the method is done. We developed a process. You can see a medical doctor here. Actually, it's a medical doctoral student doing a doctoral thesis in our university. We have CE-certified kits, meanwhile, that are used at the point of care. We can take matrices or we provide gels. And you can see one of the application and treatment of chronic wounds. 10% of the human population has diabetes, out of whom 20% develop chronic complications such as these wounds. You see this 55-year-old gentleman that developed a foot ulcer, became infected with multi-resistant Staphylococcus aureus. You see when the picture was taken, about 30 centimeters, 13 of the heel were missing, and it was scheduled for upper limb amputation. Here you can see the bone being exposed, and the tissue was very pale and gray, and it was also in a very bad genetic condition. Now we applied taking 20 cc of blood from the peripheral veins. We enriched them with the signaling peptides, put them in a gel, put on a wound, and you can see the wound cleans itself without taking any further antibiotics. But not only the wound cleans, the tissue regenerates, and it's not only the skin. We have regenerated a distance of about 13 centimeters in this patient, starting from here. This is the pigmentation area where it started. And you can see the subcutaneous tissue was still missing in this zone, but after a few weeks it also came back. So this patient recovered from a totally destroyed leg to an almost anatomically correct shape of the heel and is walking again. He also recovered from his 100% neuropathy. So when he was treated here, he received the operation and the debriding of the wound with no anesthesia. He has no feeling at this time. He now is diagnosed by a vibration test with the inner ankle here in the bone that he has 100% sensibility comparable to a normal, healthy, non-diabetic patient. So he may be protected for future injuries from the future. Now let me show you other applications that we have done in breast surgery, breast regeneration. There's a potential to help ladies after breast amputation. However, there's also, of course, an application in aesthetic medicine. Normally, when you transplant adipose-derived cells as an alternative to silicone implants, these tissues may shrink and go away. We treated this lady, we have only a few cases so far in Germany, but you can see the breast augmentation has stabilized and the tissue does not shrink like it would normally do if we do adipocyte stem cell transplantation. So what we do, we also use adipocyte stem cell transplantation, but we add the signaling that may enhance what I call the commitment to normal breast tissue. Now the scientific basis starts by looking into what type of cells are used. If you look into the adipocyte cells or the dermal cells, there are specific types of cells, and they're categorized by specific markers, which we call clusters of differentiation. They're called CDs. And one of the cell types which we find in the dermal area and the adipocyte area is a CD90 cell. And this cell type was believed to be a fibroblast. We published already in 2008 that actually this type of cell is not only a fibroblast, a scar-forming cell, it is a stem cell that is occurring everywhere in the human body. And my hypothesis is that these cells do the repair when they are needed as a first line of defense. So what we trigger in a way is just helping the cells to repair the tissue and don't become fibroblasts with the cell signaling. Other applications, cardiovascular applications, could be in cardiomyopathy, reduction of scar formation, acute MI, or reduction in wound healing problems in these patients, in many patients. Now let me in my second part of the presentation, show you other applications of this platform technology. We have shown extensively application in the skin field, and we have done 4 series of animal studies. In a controlled way, we have done larger animal studies, even in horses. And now we do establish wound care centers in Germany to help patients be treated with chronic wounds. And the first insurance organizations even start to reimburse the hospitals because wounds in Germany is the 4th most expensive disease and probably worldwide. Now, To create a more complex piece of implant, we need a bioreactor. We use this for the skin preparation, and we developed a microcontrol system. So the idea is in separating the technology that in your patient's practice or in a hospital you would only take cells from blood or bone marrow or adipose cells, and in a standardized GP method you would add it to everything that's pre-prepared like in a kit. So the cells would be added to make even complex implants. And for children we created structures that potentially could grow with children. 28 children were treated in Germany with my older technology, where we still had to do in vitro culture. And the present one takes only about 2 weeks to remodel inside the patient, and to prepare a heart valve takes 15 minutes in the operating room. Here you see a conventional mechanical implant that does not grow. This was a bioreactor that I developed more than 10 years ago already, but it's now used for making large implants. You can see a valvular scaffold, and in the operating room, the cells are injected, the system starts to rotate the cells with sediment by gravity, and after 10 minutes, it can be reopened, given back to the surgeon for implantation, and inside the patient it will remodel to create the patient's own extracellular matrix. You can see this happening here, even starting from an animal-derived matrix, which could be a porcine-derived heart valve that is however sterilized and remodels. You see the human procollagen that occurs inside the recipient. This is a video from our animal studies that we have completed before going to the first human applications. You can see normal valvular movement in this echocardiogram showing up here, and this is a normal morphological appearance of these heart valves that were, in this case, the sheep's own heart valves after 4 weeks. You can see a lot of cells in the valvular leaflet, and the controls were always fibrotic if they were not seeded. Now, it is also possible to create vascular prosthesis. For many patients with peripheral leg syndrome, after heavy smoking, they need vascular grafts. This is a vascular graft, unfortunately a little bit dark, the picture, but you can see there's a graft less than 5 millimeters in diameter. There's a very nice and shiny lumen. It is opened in the middle. The controls were always clotted in this sheep model. And again, the tissue grows inside the recipient. The process takes only 15 minutes to prepare. We harvest the cells, put it on a graft, and it's implanted immediately by the surgeon. And you see the tissue growth around the carrier matrix, which in this case was just a standard polyester material. This is CD31 staining, and this is a normal vascular graft as a control. You can see it looks very similar. Together with Professor Martin Birchall, we did a study in children that had airway collapse, and it was published recently in the Lancet. You can see the bioreactor being prepared, which has this Y shape to replace the airway inside the patient, and the child that received the graft has meanwhile grown 12 centimeters and has no complication. These are other publications in the airway field. We have treated also 23 spinal cord patients in Germany after the severest form of spinal cord injury and paraplegia. We did studies in animals, which I will show you shortly, and these were the precursor animals, in vitro studies. You can see, when I went to school, my teachers told me the brain cannot regenerate, which of course is not true anymore. Here you can see neuronal progenitor cells dividing and multiplying, but they can also make neurogenesis if you add specific vitamins, like vitamin C or A. So during this method of spinal cord treatment, you can see here a paraplegic dog, 2 days after the injury, being able to stand up. Here is the surgeon, Dr. Pfeil. It was an intervertebral disc protrusion. He did the operation, and we injected interteculated signaling factors and surrounded the injured area with the patient's own cells from the blood and bone marrow. You can see the dog at 2 days is able to stand up, but is not adequately responding to pain stimulation. And we took, in this study, only the severest cases, end stage 5, up to 35 hours of injury of patients. In a human situation, if you have a spinal cord injury for more than 5 or 10 hours in this severity, the risk to recover spontaneously is very low. You can see the inversion of the toe at 2 days still existing. However, 23 out of 23 dogs in this study all recovered completely after about 10 days. After being treated 2 times, you can see the dogs walking at 10 days in the spinal cord injury. We have some application in the field of anti-aging medicine to use the methods for neuron regeneration in isolated and incidental cases now for Parkinson cases, but we hope to start a multi-center clinical trial with the spinal cord injury. One human being was treated with C5, C6 fracture 24 hours after the ischemia, and he had a complete recovery after 6 weeks of treatment. Now, even in the liver, especially in Asia, liver disease and worldwide is one of the most frequent diseases in China. 1 out of 4 persons has hepatitis, and again, in this controlled animal study, we show you the evidence that it's probably the same type of cells. It is a CD90 cell that was believed to be the cirrhosis-forming fibroblast. But in this trauma group where 70% partial hepatectomy was done, you can see these cells that just sit around the vascular tree, and again, in these 2 control groups, they are not activated. But if we inject in this animal subcutaneously these molecules, and I call them the RHA1 peptide family, you can see the cells multiplied at the site of injury. This was a 70% partial hepatectomy model, and this is a control group that received the treatment but has no trauma. You see, this probably may be the most important finding, that we activate cells only if they are needed. I showed you the picture in the beginning. I would cut myself here. I never get twice as much skin here on the other side. The same like we have in the skin, we find in the liver. Only if you have trauma, you can activate your stem cells. This makes a lot of sense if you see how this point of care method can link to trauma in a patient or aging defects. So we seem to have a way of site-specifically directing repair mechanisms at the place where they are needed. So in this control group, which had no trauma, the treatment has no effect. But only if you have trauma, there's a dramatic increase. And these cells did not cause liver cirrhosis. It was the contrary, the livers healed faster, about twice as fast over the control. Now, one of the molecules we published was thrombopoietin, how it cannot be used clinically, so we started to develop these cytokines and peptide structures. Now, many people may ask, and there are some developments to develop kits where you just harvest bone marrow. We did a controlled animal study in a pig model to regenerate the bone in the skull. We had 4 drillings, and one of the groups was where we just took cells from bone marrow, enriched them, and implanted them with calcium phosphate-based materials. You can see at 16 weeks the bone has not regenerated. The control which we used a few years ago was our golden standard, which was an in vitro pre-differentiated stem cell culture differentiated to bone cells, and took us 7 days to prepare. And you see, the stem cells alone did not heal the bone, and this is maybe my second take-home message for you. The first one is we have to prevent cells from becoming fibroblasts, and the second one, the stem cells alone don't do the job. And this is a controlled animal study evidence that the stem cells alone cannot do the job. However, when we activate these cells that we transplant and just giving it the signaling information, even taking only blood, which has almost no stem cells in there, only 1 out of 10,000 cells is stem cell, you can see the bone would remodel in a critical size defects already in 6 weeks after implantation. So the preparation phase, 15 minutes instead of 1 week. And you see, even if you would take bone marrow, which is much richer in stem cells, it's still not a big difference. So it means every oral surgeon, an implantologist, can use it in normal practice. It is the control which has this critical size effect which did not heal, which means there's no need for cell culture anymore. And this, my third take-home message for you is your own body is much more powerful to replicate stem cells. In about 2 seconds, you can make 2 million blood cells, you release them from your bone marrow, and the response rate just in 24 to 48 hours is much bigger. In cell culture, it would take weeks to generate millions of cells. Your body can take this, would initiate this process in minutes. Now we have done clinical studies in maxillofacial surgery, and about 8 years ago, so our first human bone patient was treated with a tumor in the tibia. See, the tumor was removed, and the bone regeneration is shown here 1.5 years later in almost perfect bone trabecular structure. The same applies for cartilage. This is the publications. This was our first intraoperative application in a veterinary patient. It's unfortunately a bit dark here, but you can see an incision or defect in the cartilage, and this is the result after about 6 weeks with endoscopy. It was not completely perfect yet, but clinically this veterinary patient was able to walk with no pain. So we are now in this platform technology at the brink of going to human clinical application, and you can see our large animal study in horses right now. You can see another defect in a horse. Cartilage. Horses are very heavy animals that weigh about 600 to 800 kilograms, and a gel is intraorally just filled into the defect, and then it starts to remodel. You see, when a horse has a painful cartilage condition, the distance between the bone structures may be very small and then becomes bigger after about 6 weeks, and the pain goes away. We recently treated one racehorse in Germany, one of the leading German hospitals in veterinary medicine, and this horse became second in the Hamburg Derby, which is one of the 3 major racing events for horses on a global scale. A horse that would have normally been treated by hyaluronic acid injection, the pain would be going away for 6 weeks, and then the horses cannot be exercised or trained anymore. In this treatment, which is also like an injection into the knee, the pain went away for the face, which was about before the racing event, and it still persists now today, has no pain, and could be exercised and became so athletically competitive. Now, applications could be for the bone regeneration in osteoporosis or vertebral fractures. Now, to my end, I would like to show you more applications in other fields of medicine, like equine medicine, and linking to Tanyapur, the excellent sports facility, we would like to develop it to treating athletes after injury. Normally, when you have an athlete with a tendon injury or cartilage injury, the conventional forms of treatment in tendon is very limited. So the possibilities medical people would have to treat tendon injuries usually result in scar formation. And we have done about 150 racehorses, and the first humans are being treated right now. This shows the process. We collect the blood. Initially we tried to collect bone marrow, but it has a higher risk of collection, so we have found out it's not needed anymore. In this case, you can see the tendon being investigated by ultrasound, and then this is the injection of the cells by the surgeon here. It's a little bit dark here, into the injured area. So it's like mesotherapy, almost about 150 to 200 micro-injections. You can see here, if the tendon is injured, initially it is swollen, and after 6 to 8 weeks it becomes whiter again, which shows the regeneration. This is another ligament that is injured in humans, they have especially on the shoulder also, would be a similar condition. You can see there's an injury, and in conventional treatment it becomes worse. At 4 weeks you can see the increase in the dark spots, and in longitudinal section the tendon is also, the ligament is darkened. So after start of the treatment, you can see this zone being similar to the control, it becomes white again. Now the scientific concept, what is the technology behind it? And basically, my last part of the presentation, I would like to sum up a little bit the idea how it works and why it works, and why it may work actually. So the basic idea is to treat a large defect like a small one. So the small cut on the skin heals perfectly because it's very small. We as humans and animals, and like horses, dogs, and cats, probably higher developed animals, have limitations in their wound healing mechanisms. They seem to have a sensor built inside to find out if the wound is large or small. And if the wound is large, we have an escape mechanism that probably activates the local CD90 cells to become fibroblasts. So what we do, we just prevent it. And I call this concept a bionic concept. And bionics is just imitating nature. It was Leonardo da Vinci in the European culture to try to design airplanes like birds. And in medicine, mechanical implants have become mainstream, like hip implants or cartilage or knee replacements, for example. But what we try to do is not making a mechanical implant, it is stimulating or triggering a new signaling compound. That's how the term reset came up. It's like a restarting system, a bioreset of the human body using a scientific concept that we call the biological bionics. It's just a way of biomimetic signaling. And we treat the stem cell as a niche, so it is trying to imitate, to reconstruct the stem cell niche in vivo. And let me finish my last part by saying this hypothesis, stem cells alone may mean nothing. It's not the number of cells but how the stem cells are being controlled. So it is a method to create tissues in situ at the site of injury and in vivo in the living patient directly when it's needed as a point of care. And that's a trend that you will see on a global scale, which is a point of need. Technology in Germany, we have bakeries now where they do they bake the bread at the point of sale, or you go to the medical environment, you would call it now the point of care diagnostics. And I think the next generation will be the point of care therapy, using cell therapy processes that are done directly in the hospital, because it's a single step procedure that is immediately available. But why would we use stem cells? Of course, stem cells are the basis of human regeneration. We just trigger your own genetic program in the patient, because basically we can fix wounds in a perfect manner. We just have this limitation that we would fix only small wounds. So the biotechnology helps to overcome this limitation. In the stem cell puzzle, in a way, is the idea to bring all the signaling communication mechanisms together, and also add the cells to make it stronger. Is adding cells from peripheral blood to bone marrow, of course, adds a lot of growth factors. And like in an earthquake, like an intensity scale, I would define a stem cell intensity scale, which starts by the wound. And we have no wound in vitro. So when we amplify cells in the laboratory, we need other molecules, other factors, which may not be so physiologic like the normal initiating signals of a wound. And stem cells may be resident cells. That's also now with the local cells in combination with transplanted cells. Then they need to be receiving something like a door opener, what we call the boosting factors. It activates cells only in presence of trauma, which I showed you in these animal studies, the evidence for this. And of course, the definition of stem cells means multipotency, but this means nothing else, that stem cells don't know what to do, because they're multipotent, potentially could do many things, but they need more information. And this technology provides the information in a synchronized way when the treatment is done, when all these factors come together. In complex implants like heart valves, bone, or cartilage defects, we need a material to transplant the cell. However, this is only a temporary scaffold. And last but not least, in the spinal cord patients, we induced the patient's own bone marrow to recruit stem cells locally and release it to the site of injury. Now, the technology, apart from the science, how works the technology? It is a standardized procedure, and what we did is a separation of biology and technical systems. In the past, people were making, like I mentioned before, cell transplants like a television set. You bring cells and materials together and try to bring it to the patient. The logistics is complex, so we separate it. We do it only the cell biology at the point of care and just bring in the material. And it becomes more powerful because the patient provides the wound environment, which is one of the remaining triggers that only the patient can deliver. So what is needed is that we have developed a microprocessing environment, which is in a way a standard laminar airflow environment. However, we program the brain inside, in a way, the protocols to make bone, liver, heart valve, or skin or aesthetic treatment or wound treatment. And why would we use bioreactors? If you think back into the invention of the conveyor belt in automobile production, it was the conveyor belt that reduced the cost of the car. As you can see in Bangkok, there are millions of cars probably going around. Everyone has a car. But the standardization, the automation technology reduced the cost, and I think the same will happen in personalized medicine with respect to cell therapy product. We reduce the cost of a conventional production by a factor of 10 to 100. However, the hospital becomes the main benefactor because they start to produce it like a service. Of course, it's a skillful approach, so by reducing the external cost and hospital doing this could have a high quality implant and just do it in much faster periods of time inside the operating room and still standardize the process by a semi-automated, automated way. So I believe it becomes an automation technology in a way that could reduce the cost and increase dramatically the availability. It becomes a mass applicable technology. Now, what is biological bionics? I have shown you many examples in different tissues. Basically, it's a common basis. It's the wound. If I would have a heart attack, stroke, or a bone defect, it's always a wound that's initiating. There could be a chronic degeneration, so we initiate trauma like in the scar patient that I showed you, but we need tissue-specific protocols, and of course we have different materials, different scaffolds, different automation methods, and different processes. Apart from the scientific hypothesis that's driving me as a scientist, I would like, of course, to develop these applications in the fields of wounds and degeneration. It seems to work always when we have inflammation, trauma, or ischemia, and to set up, in cooperation with clinical colleagues, centers that do apply it, like point-of-care centers, to establish a global network of studies and application. So there are two fields of innovation. One, the science prevents stem cells from becoming fibroblasts by biomimetic sickling, and a technology that's done at a point of care takes only 15 minutes, which is a way that makes hospitals autonomous. And I will quote one of the major industrial insurance organizations' president, is a lady, she's called Dr. Demler of Siemens in Germany. She told me if this is true, it would revolutionize medicine because it creates autonomy for hospitals. Now this is the acknowledgement for a small veterinary studies led by Dr. Pfeil, who runs his own private practice also, Dr. Jan in the large animal facilities, one of the leading German hospitals, and Jean-Claude Ornita, we even treated camels in Saudi Arabia at some point, and this is the acknowledgement to my scientific group, which is mainly postdocs and doctoral students. So I thank you very much for your attention, and very happy to answer.
Thank you very much, Professor Bader. Professor Bader will stay for questions in the booth of Tanya Pura, the first booth when you enter the exhibition room, and will give a shortage as well this afternoon in the break, as well before the booth. And I thank you very much for your great attention. I hope you enjoyed the food, and hopefully you see Professor Bader with this really revolutionary method, which I followed him since 2 years to get him here, and now we have him here. Thank you very much for coming.
Thank you very much. Thank you very much.